Mpox, a viral disease that has caught global attention, has been declared a global health emergency by the World Health Organization, WHO, due to its alarming spread in Africa. But what exactly is Mpox? How is it transmitted? And why has the world taken such serious notice? Stay tuned to get all the details. Are you wondering why Mpox has suddenly become a global concern again? In this video, we'll explore the nature of the pox virus, its transmission, symptoms, and why the WHO has issued its highest level of alert. We'll also look into the current situation in Africa and the global implications of this outbreak. Mpox, also known as monkeypox, is a viral infection that affects both humans and animals. It's part of the orthopoxvirus genus, which includes viruses that cause pox-like diseases, such as smallpox. The infection typically presents with a rash that evolves into fluid-filled bumps or blisters, eventually crusting over and healing. Mpox was first identified in monkeys in 1958, and the first human case was reported in 1970 in the Democratic Republic of Congo. The World Health Organization recently updated its name to Mpox to avoid stigma and clarified that the virus can infect more than just monkeys. Mpox is transmitted through close contact with an infected person or animal. Animal-to-human transmission can occur via bites, scratches, or direct contact with the blood, body fluids, or wounds of an infected animal. Human-to-human transmission happens through direct contact with skin lesions, body fluids, or respiratory droplets. The virus can also spread through prolonged face-to-face interaction or touching contaminated objects, though this is less common. The virus enters the body through broken skin, respiratory tract, or mucous membranes. Symptoms of Mpox include fever, headache, muscle aches, and a distinctive rash that can appear on various parts of the body, including the face, hands, and feet. The rash develops into pustules, which are small, raised bumps filled with pus, and eventually form scabs before healing. Swollen lymph nodes, particularly under the arms and around the neck, are also common. In rare cases, pox can be fatal, and the infection typically lasts 2 to 4 weeks. Symptoms may take up to 21 days to appear after exposure, but the virus can be transmitted before symptoms show. The WHO has declared Mpox a public health emergency of international concern, PHEIC, due to its rapid spread in Africa, with a new variant being found in cases reported in countries like Kenya and Rwanda. This decision is aimed at mobilizing resources and international efforts to contain the virus. The current outbreak in Africa, fueled by clade Mpox, has led to over 14,000 cases and 524 deaths this year alone, surpassing last year's figures. This new variant poses a higher risk, particularly as it spreads within Africa, raising concerns about its potential to reach other continents. Mpox has been detected in at least 13 African countries, with the Democratic Republic of Congo being the hardest hit. A new variant causing milder symptoms but harder to detect lesions is circulating, increasing the risk of unnoticed transmission. The current outbreak differs from the 2022 outbreak, driven by a different clade, and is considered more deadly. Although the new variant has not yet spread outside Africa, the risk remains if the virus continues to spread within the continent. There are no approved treatments or vaccines specifically for Mpox, though the antiviral drug tecovirimat, Mpox, is being studied for its effectiveness. The FDA has approved a smallpox vaccine, JYNNEOS, for severe Mpox cases in adults. However, the majority of cases in Congo, the epicenter of the outbreak, are in people under 18, highlighting the need for accessible treatments and vaccines. The CDC recommends vaccination and isolation for those exposed to Mpox, but challenges remain in rapidly diagnosing and treating the virus, particularly in affected African countries. That's the latest on the Mpox outbreak and why it has been declared a global health emergency. As the situation develops, it's crucial to stay informed and understand the risks. What are your thoughts on this resurgence of Mpox? Let us know in the comments below, and don't forget to like, subscribe, and hit the notification bell for more updates on global health issues. Thanks for watching!